5. Thank you, Deputy Premier. 4, 3, 2, 1.
Good morning, Queensland. We've just finished our morning COVID briefing with the Premier, and I can advise that there are 16 new locally acquired cases, all that are linked to the Indooroopilly Delta cluster. One new case is linked to Indooroopilly State High School, 4 cases linked to Brisbane Grammar School, 2 new cases linked to Girls Grammar, that's a student and a teacher, 3 new cases linked to Ironside State School, 5 new cases are household or family contacts of already confirmed cases, and 1 the neighbour of a known case. That brings the total number of cases in this cluster to 47. Our total number of cases throughout the entire pandemic, 1,840. Pleasingly, in the last 24-hour period, we did 34,718 tests, which is an excellent result. It's shy of our record and shy of the target that the Chief Health Officer has set for us to be in the 40,000s. We are extending hours at testing locations, and new sites are opening up. So I'd just like to thank everybody who waited to get their tests. You're making a important contribution to our efforts against this outbreak. Queensland Health did more than 10,000 vaccines yesterday, bringing the number of Queenslanders who've had 1 shot to 36.97%. We now have at least 7,995 Queenslanders in quarantine and at least 4,089 in home quarantine, but probably much more than that. And it's important that while all of us in the southeast have to stay home, those who are subject to home quarantine directions are legally required to stay home. They cannot leave home except in an emergency or to get a test. They're subject to a legal notice. They must stay in their residence for the 14 days or until the date provided on their notice. They cannot leave their residence unless it is to get essential medical care, to avoid injury or illness, or to escape a risk of harm, or to get tested, and even then only under the instructions provided to them from Queensland Health. They're also not permitted to allow anyone else into their place of residence unless they live there, or to provide emergency or medical care. If anyone is in home quarantine and needs supplies or assistance, they can contact the Community Recovery Hotline on 1800 173 349. Everyone in home quarantine is doing us all a service and keeping us all safe. They're there because there's a risk that they've been exposed to the virus, and we just urge everyone to comply with those directions. The lockdown currently in place in the southeast, it's important that it's complied with throughout all 11 local government areas. There are concerns of exposure not just in Brisbane, but also on the Sunshine Coast and the Gold Coast, and that's why we've included all of the local government areas in between. That includes an exposure site at Southport. The Premier and I and the Health Minister and the Treasurer met with all of our mayors yesterday, and the overwhelming feeling was that we are all in this together. We are all working together to keep our communities safe. And finally, in a moment, the Deputy Commissioner will outline the number of breaches identified by police yesterday, breaches with the various health directions. It's disappointing to see so many people breaking those rules, and I think it should just underline that police are and will be enforcing the lockdown and these health directions. They shouldn't have to, and so by breaching them, we make the job of our police harder, the job of our health contact tracers even harder. And so we just urge everyone to be aware that police will be enforcing the lockdown and all of the health directions.
Thank you, Deputy Premier. So we have 16 new cases in this cluster, which means we have 47 in total. All 16 of these new cases are related to those Indooroopilly sites and schools, which is really good. We haven't seen any from outside there. I am still concerned, though, that we don't know how this outbreak has happened. So we know the very first 2 cases that arrived into Queensland on the 29th of June, but I don't know how it's got from either of those 2 people to the first family in that Indooroopilly Taringa area. So we do need to continue testing throughout all of those 11 LGAs and throughout Queensland. It's really important so that we can just make sure that we don't have any other transmission events, any outbreaks happening. So please get tested. Any symptoms at all, come forward and get tested. And please don't move the virus. So wherever you are in the 11 LGAs, if you can at all, just stay put so that that virus then doesn't move, because we know that there are people out there who could have been infected who have no symptoms. So the best way to deal with someone who has no symptoms is that they just stay at home. That's why lockdowns work, because we know that the virus can burn out. So please just stay at home. If you are thinking today, when you get up and you start your day, if you're thinking, will I or won't I go out? Can I or can't I? Just stay home. So if you're uncertain, just stay home. And if you need assistance, please, you can ring for help. Of course, anyone who needs food, you can go out and buy that food if you need it. Of course you can. But if you don't need to leave home, please don't leave home. And that way, I hope that if we do have other chains of transmission out there, it'll burn out and we can lift these restrictions, this lockdown requirement at 4 p.m. on Sunday. But if we continue to see cases, that will stop us being able to do that. I'm really hopeful, given that we've had so much testing done, and I do challenge everyone in Queensland. I'd like to reach that 40,000 mark. But look, the testing has been absolutely fantastic, and today the roads were empty. When I drove from my house to get to the freeway to come into town, into here, there was only one other car on the road, and that was an ambulance from that bit to the freeway, which was excellent to see. So please, everyone, just stay at home if you can at all, and that way we'll get through this and we can lift on Sunday. That's absolutely my aim, and I'm sure every Queenslander's aim. Now, vaccination results have been really good. So now we've got up to 18.47% of Queenslanders today are fully vaccinated, and 36.97% have had the first dose. So we've been working with the Commonwealth, and we will have more AstraZeneca supplies. So anyone who is 60 years of age or older, please come and get your first dose if you haven't had it. And if it's more than 8 weeks since your first dose of AstraZeneca, go and get your second dose. I'll be doing that as soon as I can organise it this week. So please, second dose, more than 8 weeks, get that second dose of AstraZeneca. That's really important. And anyone in those critical groups, we still don't have all of our healthcare workers and aged care workers vaccinated. We need them all vaccinated. So far, this outbreak hasn't affected school kids. So we've not seen their grandparents infected. So if you're a grandparent of one of these kids, one of these households, and you haven't been vaccinated, please don't go anywhere near your grandkids. If you've had 2 doses of vaccine and you normally provide care for grandkids so that their parents can go and do essential work, then that's fine. But if you haven't had your 2 doses of vaccine and you're 60 years of age or over, please just stay home. It's really important because you are at significantly more risk. Thank you.
So thank you, Queensland, for coming out in such great numbers to get tested over the last 24 hours. As we've said, we're just shy of our record of around 35,000 vaccines. We want to see that broken today. We will have additional sites opening up. We have a new site at Moggill opening up tomorrow. At Indooroopilly State High School, can I make it clear that this site is only set up for the school community, not for the general public, so that we can prioritise those students and teachers and staff and their immediate family to get tested. So we are extending the hours at Indooroopilly State High School. It will be open till 9 p.m. this evening, and we are also looking at the site at Kenmore, a drive-through site seeing if we can extend the hours there this evening as well. We are setting up a new site at Moggill District Sports Park tomorrow. It will be a drive-through site as well because we know there is a lot of demand in that area. The message this time for this lockdown is simple. Don't ask yourself, can I go out? Ask yourself, should I go out? Is the reason I'm leaving my home so important it is worth risking an extension to the lockdown? We are in different times with a different virus and we must act differently. So please, think about your reasons why you are leaving your home. Is it truly essential? Go with your gut feeling. If you're needing to ring health or my office and ask, can I do this? You probably can answer the question yourself. If you don't have to go out, stay home. Because if you are out moving around, the virus is potentially out moving around without you realising it. Each and every one of us can make a difference to keep 5 million Queenslanders safe. So let's make the right choice. We've done it so well in the past. I know we can do this. And if we do it well, and we do it hard, and we do it quick, then maybe we can get through this week. That's what we hope, but we need more people coming out and getting tested, and we need more people staying at home. Of course, if you are in quarantine as a close contact, you can only leave home to get tested and for no other reason. If you need any assistance at all, as I say, ring 134 COVID so that we can get you the support. Of course, remember last year, we helped out our neighbours who we know were in lockdown. If they need a food parcel, if they need groceries, give your neighbour a call. Don't go knock on their door. Give them a call if you've got their number and say, do you need any groceries or items? Leave a care package at their front door. That's how you can help. But please, don't go visit your neighbours right now because, as we've heard today, one of the new positive cases is a neighbour. Now, of the 16 new cases today, at least 9 of those are young people. 9 are confirmed students, and we have another 5 household members, which potentially there may be young people in that household group as well. So a minimum of 9 out of 16 are children. So let's make sure we're keeping our children safe and our most vulnerable in the community by staying at home and following the directions. Now, yesterday, I understand the Commonwealth Health Minister announced that he could offer 150,000 extra AstraZeneca doses to Queensland immediately. That is fantastic. We will take them and more. I've already phoned the Pharmacy Guild yesterday afternoon on hearing this news, asked them if they had 150,000 vaccines available of AstraZeneca, can they use it? Can they get this in the arms of Queenslanders across southeast Queensland in a matter of days? And they've said yes, they will take it. So I asked the Commonwealth, do whatever accreditation or approvals you need to give today, get the 150,000 vaccines here tomorrow, and we will ensure that more Queenslanders are getting vaccinated by the end of the week. That also goes for GPs. I've heard from GPs that in the last 48 hours, they have been getting an enormous amount of calls from people saying, I want to come forward and get my AstraZeneca. That is great news, but now some of them are worried they're going to run out of vaccine. So if there is more supply available, we will work to get that for them. This is really important because we've had a 4% increase in vaccination doses over the last 24 hours, which is incredible. But of our 60-year-old to 69 age group, less than 20% have had their second dose. So what we'd like to do, and only just over 42% of 70 plus have had their second dose. We would like everyone going to get their first dose of AstraZeneca to go to a GP, and we want that to be every GP that is on the National Immunisation Program. Every GP or pharmacist who is eligible to deliver a flu shot today should be eligible to deliver the AstraZeneca. So we've been asking for this for months. The quicker we expand, more GPs and the pharmacists, the more we can get our people vaccinated. So what we'd like to do is people go to their GP for their first vaccine, consult with their GP, and once they're ready for their second dose, we want our pharmacies to be there to roll out that second dose for as many Queenslanders who are eligible and can get it. So thank you to the Commonwealth for that call and offer of 150,000 AstraZeneca. We'll take it. Our pharmacists will take it. And let's get more people vaccinated. Thank you.
Unfortunately, yesterday saw the highest level of enforcement we've had to undertake since the pandemic began. We issued 70 penalty infringement notices, 34 of which related to the protest activity we saw here in Brisbane. And we also arrested 21 persons, 15 of which related to that same protest activity. We responded to 146 calls for service, so they continue to rise, and we handed out 168 masks. I'm sorry to say that the types of offences we're seeing in this is exactly the same ones that we've seen all the way through. People failing to carry masks and refusing to put them on when they're given the opportunity to do. People being out and about in the lockdown when they don't have an exempt purpose to do so, so no valid reason to do that. People being given directions and the opportunity to comply with police and refusing to do so. It's really quite unacceptable that all of our community vastly take this very seriously. We in the police take this very seriously, but there is a portion of our community that think that they can continue to do whatever they think they want. We're simply not going to tolerate that. We're going to increase our presence in the community. Our community can expect to start seeing things like an RBT type interception on our roads, where we'll check to see whether people have the right reasons to be out and about and whether they're going about their business. The community has nothing to worry about if they fit within those exemptions and those valid purposes for going out and about. Of course people need to go out and get essential supplies. Of course people need to go out for essential purposes. They have nothing to fear. They have nothing to fear if they're doing the right thing or trying to do the right thing. Our police officers will help them. But those people out there, the message is very clear to you. If you know you are doing the wrong thing and you do not intend to change your behaviour, there are serious consequences. It is a $1,378 fine for contravening a direction from an emergency officer, which includes our police. It's a $206 fine for a mask. And if you continue not to comply with our directions, you face arrest and being put before the court. Thank you.
Can I just ask on that on the anti-masking thing, people who are refusing to wear masks, we've heard police are complaining that there's circulating on social media directions about you can say, oh, I have an exemption, no, you don't need to prove it. Are you finding that happening?
Look, there are genuine medical reasons, and which I can leave to the show to talk about, why people don't have to wear a mask. What we expect when we engage with them is that they can work with us to prove or show that that is a genuine purpose. We will always take a communication, compassionate approach to that. So we'll work through them. But if people are deliberately trying to mislead, there's really quite serious consequences to this. I was really disappointed to see some reporting last night where a gentleman was saying that masks don't work. The science and common sense tell you that's absolute rubbish. People need to stop listening to that sort of stuff. It's just not correct.
Deputy Commissioner.
Deputy
Commissioner.
Sorry,
Deputy Commissioner.
One moment. I do want to raise this. If someone cannot wear a mask because of a medical reason, and if they have not had 2 doses of vaccine, they need to stay home. They shouldn't be out and about. These masks are to protect people. So if you cannot wear a mask because of a medical reason, and there are medical reasons for it, and you haven't been vaccinated, you are at really high risk. So stay home, and the Care Army has been activated again, and they will help if you can't organise food or essential goods. Don't go out of your home if you can't wear a mask. I hope I'm being really clear. That is to protect yourself. Please don't find excuses to not wear a mask. I think masks have stopped the last 14 incursions of this virus into our state from spreading. It is just this 15th one that has led to spread. Masks are absolutely critical.
Dr. Young, there were reports this morning that a underage soccer player has tested positive. There was an email from the club apparently. Do you know if he's included in today's numbers?
I don't know the specifics of any of the cases other than the information that's already been given.
And do you have a benchmark for Sunday lifting of the lockdown?
On Sunday, will want to have seen that any new cases that have been coming up have been in quarantine for their full infectious period.
Do we know how many have been in quarantine for their full infectious period?
Not many at the moment. Some of them have been out infectious in the community for up to 6 days.
So
it's too early in the outbreak to expect that all of these people will have been in
So it
quarantine.
wouldn't necessarily be based on the number of cases, it would be
No.
the...
It'll be where those people have been. Someone who's been in quarantine for their full infectious period doesn't concern me. It's people who've been out and about, so there are more exposure sites.
Do you obviously still have concerns for the Sunshine case without tracking down this missing link, correct?
Yeah, oh yes, definitely. Although I've got some more genome sequencing today that is starting to show that this virus is branching off, which suggests to me that those 5 initial cases in that family were fairly closely related to one of those 2 cases. There's still missing cases between them, absolutely, but possibly not a large number. But even one, we know, even one case can lead to another outbreak. We know that. So that's why the 11 LGAs, it's critical that anyone with any symptoms at all in those 11 LGAs comes forward and gets tested, and that people stay at home, because there's about 20% of people who won't develop any symptoms, but they can still spread it. That's why lockdowns work, because they keep the people at home who don't have symptoms, who could lead off to another transmission event, because they mightn't have symptoms, but the person they give it to could then get symptoms, and the next person.
On the Gold Coast, the Mayor's calling for lockdown to lift there because they haven't had local infections. What do you say to those?
I think he's subsequently clarified that opinion. Can I say the mayors here in Queensland have been absolutely brilliant. I speak to them on a very regular basis. They are such a congenial group, and they really work well together, and they are the basis of our response in any disaster in Queensland. They are absolutely critical, and they've been working with me so closely in terms of testing venues, in terms of getting people vaccinated, in supporting each other. So really, I think that's one of the reasons that we've had such a great response in Queensland.
Just the 9 new cases that are students, how concerned should parents be, given we're seeing this younger trend of younger people, particularly students, getting the virus?
Yeah, parents do need to be concerned, so that's why they need to come forward and make sure their kids are getting tested, which they're doing fantastically.
There's a lot of confusion out in the community around what an essential worker is. Do you need to further clarify that?
Yep, we did put out some clarification last night, but if you've got a question whether you're an essential worker, then you're probably not. So really and truly, my advice is if you can stay home till Sunday 4 p.m, when I hope we can lift this, then please just do that. Just stay home.
Dr. Young, are you aware of a case of 2 people, a couple in Roma, that had come from Victoria with permits? There may be questions over they filled the permits out incorrectly. That's not being disputed. And the Deputy Commissioner may be able to add something on this as well. They were then ordered to the edge of town by police, told to drive to Roma, they tried to drive to Brisbane, get themselves to hotel quarantine without test results. Subsequently, they broke down halfway. Were told by police that they weren't to stop. It's a 480-kilometre journey. Are you comfortable with this process? And this is not the only case.
I just want to thank every single person, I don't have it on me today, I'll get it for tomorrow, how many Queenslanders have gone into quarantine from the start of this pandemic. Let me finish, please, let me finish. I really and truly, they have been the absolute heroes. I haven't done it myself. I know our Premier is doing it today. To spend 14 days in isolation is awful to ask people to do, whether that be at home or in hotels. But that is so critical. That is what has saved us time and time and time again. If we hadn't have had that process from early last year, we would have been exactly where so much of the rest of the world is. So I don't know the specifics there, and I'm sure police...
Are you comfortable with that process though, Dr.
I am very comfortable with our process for asking people... Could I finish, please?
That they've driven themselves without a test result?
Yeah. We don't need test results. Test results are too late. Please, no one out there rely on test results. It's our job to get test results. Till anyone gets a test result, they need to isolate themselves. They can do that in a car on a drive, of course they can, if that's what they've been directed to do. We'll look at that specifically. But look, I just say this is not ideal that people are having to quarantine, but it's one of the best mitigating factors that we have. It is so critical, and I thank every single person in Queensland who has gone through quarantine, and I know some people have gone through it multiple times, but that is what has kept Queenslanders safe. Now, as for the specifics, if you can give the media team the specifics, and of course we'll go and look into it. Of course we will. Thank you very much for
Deputy
asking.
Commissioner, have you seen that case at all?
Sorry, Dr. Young, do you know how many teachers have contracted COVID now?
Several have. So today there was another teacher, and we've previously had several teachers. So it is really important, and we've brought that in now, that teachers, when they go to school, no matter what age group they're teaching, unless it's deaf children, must wear a mask. We know masks protect. For deaf children, they need to wear a shield so the child can see their mouth.
Are any of the cases went to this cluster in ICU?
Not out of this cluster. We still have one gentleman in ICU. He's not ventilated, but that's from a previous cluster, not from this outbreak.
Dr. Young, on the implications for the health workers, have you made any progress in, can you just talk about like the
unfortunately, we have well over 400 of our health workers now in quarantine. So last night I had to make a decision because all of our cardiac surgeons for the Children's Hospital were in quarantine. So we worked through how we could allow one of them to go and operate on an urgent case. And we will do that every single time. No Queenslander will be denied any care because the health workers they need are in quarantine. We'll work through that. But we do have a large proportion of our critical health workers now in quarantine. So unfortunately, we have had to delay some surgery and some outpatient work to manage that. So, but we'll be working that through.
Is it an option to rotate people in from the regions, or you wouldn't want to move people around?
No, because the regions have already been impacted, because any of their health workers that have been in Brisbane haven't been able to return to the regions. So the regions are already struggling. So no, we can't rotate.
Deputy Commissioner,
how many of those 400 health workers would have been vaccinated?
Most of them have, yes, that's a very astute point. But unfortunately, at this stage, we know that although you've been vaccinated, you can still pass it on. And this is too critical. We cannot have health workers go into a hospital who can potentially pass on the virus, because then we risk that entire hospital, as we saw a few months ago with the PA being totally closed down. So we've got to work it through, but that's why last night we worked through that worker was quarantined so they could go in and operate.
Would you say all of them are vaccinated, confident?
Most of them are.
And circling back to the 16 cases in the community, do you know how many of those may have been infectious while in the community and for how long?
Most of them have been infectious in the community. Of those today, some of them up to 6 days.
On that reiterated message that you keep saying, you said yesterday quite adamantly that if you're in an office and you don't need to be, you shouldn't be. How does that extend to the broader exemptions for retail? We're seeing things that were a concern in Sydney when they had Louis Vuitton shops open. Here we've got JB Hi-Fi, Cotton On. Where's the line on that, and is that being enforced? Are they deemed essential, and why are they open?
They're not essential to me. I would hope that they've heard that message and they make a decision.
Dr. Young, do you think your warnings around AstraZeneca for younger people has contributed to Queensland having the highest vaccination hesitancy in the country?
I don't believe we do have the highest vaccine hesitancy. What I want to see is that anyone who is 60 years of age or older immediately goes and gets vaccinated. I am concerned that there is still a significant proportion of that group, and that group is most at risk of getting the worst outcomes, that isn't yet vaccinated. So I will be going this week to get my second dose of AstraZeneca, because it's now more than 8 weeks since I had my first, and we're now in an outbreak. And the ATAGI advice is that in an outbreak situation, instead of waiting 12 weeks, you only need to wait 8 weeks. So that's really, really important. And anyone younger than 60 should go and talk to their own GP about what their risks are and what they should do.
What about teachers, Dr. Young? Should they now be sort of pulled up the line a little bit?
Well, that's why schools, and the Minister is here and can speak to it, are asking teachers to stay at home where that's possible, because unfortunately, much as I would absolutely love to vaccinate every teacher immediately, we just don't have enough doses yet. So any teacher who's 60 years of age or over, and there are some, should be going and getting AstraZeneca. Younger teachers need to go and make that decision with their GP.
Kids be at home, do you think, during this lockdown, or some kids can attend school?
Yeah, some kids can attend school, but only those children of essential workers. I need our hospitals to continue. I need police to continue doing their job. So there are some people that I need to be able to still go to school, and of course any vulnerable children. But education has a very, very good system in place. They're cohorting kids into smaller groups to minimise the risk, and they're managing it very, very carefully.
Are you comfortable with the numbers of children turning up? And also, do you have a message for employers who are still requiring their employers to do the same amount of work, even though they're at home with their children, and that pressure to send their kids so they can get their work done?
I am sure that employers are very understanding and will work with their staff. It is hard, I am sure. My kids have grown up now, but I'm sure it is very difficult to work at home when you're also looking after young children. But that's what I'm asking everyone to do wherever possible, and hopefully we can lift that on Sunday. But if we all do that really hard work now, it can bring this to an end. If we don't do that hard work now, this is likely to linger on.
Dr. Young, that ATAGI advice around the outbreak situation also suggested that people reconsider the risk-benefit ratio. Have we reached that point in Queensland now?
The ATAGI advice says when you reach a large outbreak, which I think we're on the verge of, I hope it doesn't become any larger, but I suspect it will, then that is the time to go and have that discussion with your GP.
So what would that look like for you? What is that threshold for you?
By Professor Reid yesterday, and the Health Minister around the Commonwealth hotspot being a trigger for that. You wouldn't agree with that?
No, I absolutely agree with it. The Commonwealth has worked very closely with us, and as you heard from the Health Minister, has given us 150,000 extra doses of AstraZeneca. I want those extra doses going into arms this week. That's critical.
But that Commonwealth hotspot wouldn't be the trigger for a large outbreak?
Yes, that is the trigger when the Commonwealth gives us additional resources and also gives financial assistance. So yes, I think that is a very good trigger point.
Sorry, should young people be talking with their doctors now about getting AstraZeneca?
Yep, this is the time that people who are under age 60 should be talking to their GP about what is best for them as an individual. GPs know their patients and know what advice to give them.
Deputy Commissioner, can I ask a question, Deputy Commissioner? Just again on this case of this Roma couple, I don't know whether you've been briefed or not, but they were told, given a direction by police, driven to the edge of Roma by an officer, then told to drive the 480 kilometres to Chermside. They were then told by the officer the only way they could stop is if they had a credit card to swipe at a petrol station. They then told the officer their car wasn't right. They broke down halfway. They then rang police again in Roma when they'd broken down, to which the police replied to them, "It's not our problem." They were then told that if they didn't arrive on time, they would be fined again. It's a 480 kilometre drive without a stop. Are you comfortable with that process?
So I'm aware of your story, so I have asked for a complete briefing on the circumstances around that. I haven't got that yet, so I can't comment on the facts of that particular instance. I'm aware that there's a process that we have been using all through this pandemic because of the large numbers of people we have, and this is done in collaboration with Queensland Health in terms of ensuring that we can get people into quarantine the most effective way. Now, one of the things we have in our system is that we place great trust in our community and their honesty and their ability to work with us. So yes, of course there are instances where people are given directions and asked to go there, and there's conditions put around that, and that's been happening consistently through. So that's the process. The individual circumstances of this case, as I said, I need to get a full briefing on it, as the Chief Health Officer said, and work out what's happening.
Deputy Commissioner, we've seen on so many, there's been so many examples of people doing the wrong thing. For the most part, people do the right thing. Again, would you be comfortable with that process of allowing people to drive themselves you know, through these small towns all the way to Brisbane to report to quarantine?
So I'll dispute your assessment there of the large numbers, because I can tell you that we've intercepted over 1.5 million vehicles, and we're talking about a handful of instances where things have not gone well, and that's really validated by how the infections have unfolded in the state. It has been a very effective system. So we're talking about very small numbers here. Now, if there's been a particular instance, where we've got it wrong, I want to know about that, and we'll look into it in detail.
What have the other breaches been? You talked about protesters. What other breaches have you seen that are quite common?
Look, the protests, we see real consistency. People are out against the Chief Health Officer's directions for the purposes they should be out, so essential purposes. Look, in thousands of instances, people simply don't understand, or they think they're doing the right thing. We work with them, we give them advice, they then comply, we move on. The people, and I'll say it again, the people that end up having enforcement action taken against them are the ones that are given an opportunity to comply and willfully and intentionally disobey the directions.
What's being done about businesses though, Steve, like EB Games and Cotton On being open?
We're doing business compliance checks as we always have. I don't have today's figure, but as of yesterday it was, for one day, I think we've done over 70 businesses checks, all had been compliant.
So you're saying those stores can stay open, stores of that nature?
Look, I think, go back to what the Minister and the Chief Health Officer has said. Ask yourself not whether you can, ask yourself whether you should, and if you don't really need to and it's not absolutely an essential purpose, stay home.
But are you asking them to police that themselves rather than from an enforcement perspective?
Throughout this whole pandemic, and indeed in this, we are asking the community to police themselves. We've got 3.5 million people, or thereabouts, in the southeast corner here in lockdown, and we've got a few thousand police. We're not going to be able to be across everyone. The community's been brilliant. We don't need to police the general community because they do the right thing. We're targeting ourselves against those people that are doing the most risky behaviour.
Health Minister, why didn't Queensland order any AstraZeneca in July?
Because the reason why we haven't ordered any in July is because our priority group, as agreed with the Commonwealth, is frontline workers and the 40 to 60-year-olds. So it was agreed, and as per ATAGI's recommendation, those people were getting Pfizer. So we have always been the primary administrator of Pfizer vaccine to those priority groups, and the general population, so those 60 plus who are to get AstraZeneca, have been getting delivered through GPs and the Commonwealth vaccination centres. That is the agreed plan between the Commonwealth and states and territories. We were delivering Pfizer, and the GPs and the Commonwealth vaccination centres were doing the AstraZeneca once the recommendations changed around ages. Now, as advice changes, then we will change our approach as well, but we still believe that the pharmacies and our GPs are in the best position to roll out the AstraZeneca to the general population. One, because people should go to their GPs and get advice, and also pharmacies administer our flu vaccines every single year. People have confidence and trust in going to them for immunisation, and we know that if we can redirect second doses from GPs to pharmacies, we can free up a whole lot of booking spaces with GPs for those first doses. So I think we've got the mix right. It's in line with the agreement with the Commonwealth, and our concentration is on Pfizer. So we have contacted the Commonwealth and said, can we bring forward our August supply to now? So we're supposed to be getting around 84,000 Pfizer vaccines a week, each week of August. We would like to bring that whole supply forward now, which means we can ramp up the doses that we're administering every single day. But we can't do that at the moment until we get that extra supply of Pfizer as well.
Minister, were you offered extra AstraZeneca by the federal government during June, around 100,000 doses?
I'm not aware of being offered extra AstraZeneca in June. As I say, we've been delivering Pfizer as agreed to. It was some time ago when the rules changed around the 60-year-olds. We actually said to the Commonwealth, can you redistribute our AstraZeneca supply to GPs? GPs were wanting it. We didn't need it because our frontline workers and those who are 40 to 60 were being recommended to get Pfizer. So there was no point us holding on to AstraZeneca when GPs were wanting it, needing it, and they were doing the 60 plus. So that was the right mix. The Commonwealth were more than happy to do that, have not raised any concerns with our supply of AstraZeneca. And I was surprised to hear the comment yesterday from the Commonwealth talking about whether we had ordered any or not. Let's not play semantics, let's not play politics. If there's 150,000 AstraZeneca that can come to Queensland, let's get it today, let's give it to the pharmacists and let's get people vaccinated. Thank you.
Okay. Thank you.
Education.
Education.
Yeah, thank you.
Minister, do you have any more details on exactly how many teachers are now tested?
Other than what the Chief Health Officer reported this morning, what we want to do is obviously make sure everyone is tested, and of the 16 cases I think there have been some teachers that have tested positive, but we want to make sure that obviously the isolation and the quarantine will reduce those numbers over time so we can end the lockdown on Sunday. But can I take the opportunity to thank the teachers and the hardworking staff in schools. They have done an amazing job. We've started remote learning today. It's gone very, very well. We have incredible capacity on our system in order to provide that, and as you all are aware at the moment, we are with skeleton staff, minimal staff in schools. The Delta strain is completely different to what we had last year, and so we're taking all necessary precautions, but obviously making sure that all the student needs are looked after when they are at school.
And if you've got some voting, should they have been vaccinated early?
Look, we take the health advice, and obviously anyone over 60 can get vaccinated with AZ, and we will take the advice of the federal government and the health advice. If that changes, I will implement that straight away.
What's happening with the show mentioned like smaller cohorts in schools and managing that? Can you talk us through what's happening practically?
Yes, and I think that this is a practical way of saying, please, unless you are truly an essential worker, we want to minimise the number of children and students in school. Please, unless you are absolutely necessarily needed in your workplace, stay at home with your children. However, if you are an essential worker, and obviously we need those workers in the workplace, nurses, doctors, police, paramedics, what we will be doing is making sure that there are smaller cohorts together in schools of those essential workers. We're roughly aiming at between 5 to 10 in the various cohorts, and then we'll be rotating staff to make sure that their needs are met.
Is it taking a while to get that structure right? We heard that at Kenmore yesterday there was about 100 staff and only 8 students and essential workers. Is it a bit of a process to get that balance right?
Yesterday, the reason why we had the staff is they were working on the delivery of the online learning. Today it is now available, but now we've moved into the skeleton staff in schools, and teachers who can will be working remotely from home, and obviously we'll be delivering the learning requirements for students online, and as I said, that's rolling out smoothly so far this morning.
Minister, in terms of the ECA public show holiday, are we going to have one, and on what day is it?
Yes, well, that's a good question. I'm in discussions at the moment with the Premier and Deputy Premier. We are looking at our options. I can cancel a public holiday, but we need legislative change to reappoint another day. So we'll be making an announcement soon, and we're looking at all the options.
Minister, are you concerned that there are parents that aren't essential workers that may be dropping their kids off at school, and do you have a stern message for them?
Look, I think I just want to reiterate the Chief Health Officer and the Health Minister's advice. Ask yourself, am I truly an essential worker? Please, we want to minimise the number of children at school, but of course, if you're required as an essential worker, truly and really, then of course you have a right to drop your kids off at school, and their needs will be looked after.
Would you be able to give some insight into how the skeleton staffing might work throughout schools for parents that may be watching?
Yes, every school community will be assessing how they will be accommodating the needs of the students. Obviously, we had, I think, about 6 to 7% attendance yesterday. We're hoping that that will drop off. We'll have attendance numbers by 11 o'clock this morning. Schools are very well equipped to know from parents who will be dropping off their children and not, and they'll be making arrangements so that their needs are met, and of course the needs of the teachers as well.
Just on the ECA again, like how much time do you need before you can make the call on that?
We'll be making a decision fairly soon. I'm in discussions with the Premier and Deputy Premier and other local government areas that joined us last time. So we'll get a clearer picture today, and we'll make an announcement very soon.
Why is it that state schools don't conduct online classes? Private schools are, or is it just emails with bulk work?
Oh, look, I think it's a mixture of both. There are some very young students who obviously work very well with hard copies. Every school is different and every school accommodates their needs. They do an excellent job and no child will be disadvantaged.
And what do you say to, I guess, teachers who are under enormous stress with the current circumstances, virus running through schools?
Look, I think we're all under stress at the moment when it comes to this Delta strain. It is one of those strains that is very unpredictable. I want to thank the teachers and all the staff in schools. Can I say the principals, the teacher aides, the staff who work in the admin area, the cleaners, all of the staff in schools have done an amazing job and I thank them, and we'll get through this, and hopefully if we all work together, we're doing what we can to ensure everybody's safety.
Considering Dr. Yen's advice then about this is now an outbreak, consider you talk to your doctor about getting an AstraZeneca if you're under 60. Should all teachers be doing so now if they're not already
in relation to what teachers should or shouldn't do about getting vaccinated, I would adhere to the Chief Health Officer's advice.
Thank you. Thank you very much.
Thank you.